Hello friends, welcome to our show. A lot of people are suffering from various health problems and one of them is varicose vein. Let me introduce to you Dr. Pradeep Mule, Senior Consultant Interventional Radiologist practicing in New Delhi, India. Welcome to the show, Dr. Mule. So we can see a lot of people are having problem in their legs. Normally they are diagnosed with varicose veins. So I would like to know what are varicose veins?
Varicose veins are a superficial dilated veins.
Okay.
In beginning, like you see some blue vein, tortuous vein, zigzag kind of the shape, right? So these are the varicose veins. These varicose veins are connected from the ankle to the groin area.
Okay.
And this continue as a up to the heart also. So whatever the blood flow in this one, right? Because of the venous blood, this goes from the leg to toward the heart. So these are the dilated vein, tortuous vein. These are the varicose veins.
Okay. So generally they are connected from the whole leg to the groin area. And talking about what generally happens to varicose vein?
In majority of the patient those suffering from the varicose vein, in beginning actually they don't have any problems. But once the time goes, right, so because of the long standing, long working hours, and when they are suppose a gym trainer or something, a lot of people they have a long standing kind of a job like a policeman, nurses, doctors. Now the young people they work in the mall and other things also, right? So once this progress with the time and your long standing duration increases, so these veins become a little nuisance. These veins become a little more prominent, more blue, and after some time when you stand for a 1 hour, 2 hour, so they start giving some problem like a pain comes, diffuse kind of the pain comes, boring kind of the pain comes. So these are the comes in the varicose.
Basically these are because of the general excess of blood flow in these veins?
Normally in varicose vein so many walls are there. And these wall having the function to take the blood from the down to toward the heart. But by any reason, by these are the problems, right? So if any wall that get damaged, right, so this blood is not going up. Is all the blood is pulling down into the leg. That's why this produces the pain, heaviness in the legs.
What are the symptoms of varicose vein?
In majority of the varicose vein, they don't have any kind of the symptoms. But if this progress little further more and long duration standing and other things, right, so they start getting the pain. Pain, sometimes diffuse pain. Some people they say, no, I don't have the pain, but I have the heaviness in the leg. And if this continue furthermore also, so they may start getting some swelling also. These all the pain, heaviness and the swelling, not much in the early morning. When they start doing their work and other things, like by late evening or before the sleeping, this become a worse. And later on, if this progress furthermore also, so they may develop sometimes there's some pigmentation, color changes in their skin. These color changes and pigmentation particularly come from around the ankle and the lower leg. And these spots become a little more darker also. 20 to 30% of the people those suffering from the varicose vein, they say that now they have a lot of itching and other things also.
In the legs only.
Yeah, in the legs only. And if they have the itching and other things, right, the pigmented area over that skin is dead, so they may peel off and they may sometimes develop the small non-healing ulcer kind of things also. So these are the common symptoms in varicose veins.
Then that may look very unpleasant to look.
Yeah, unpleasant. And cosmetically is the total nuisance actually, right? When you see your all body structure and this thing is absolutely fine, your skin texture and other things, but you see the leg, then it's look very bad. Right? So that's nuisance is there.
Attacks you emotionally as well.
Yes.
So how can varicose vein be diagnosed?
For diagnosis of varicose vein, those suffering from the varicose vein, most of the people they know that this is the varicose vein because it's very easily visible. Right, dilated, tortuous veins we are seeing in the leg, right? So most of them they knows that I have this problem, right? And when you wanted to further some more evaluation, what the inside exactly the going on in your leg, right? So we need the ultrasound color doppler. This ultrasound color doppler that tell us what the direction of the blood flow. Normally the direction of the blood flow in the leg in the venous system is from the down toward the heart. But when you do the ultrasonography or a color doppler or you do the mapping at the same time, you see the reversal of the flow is there. So that
upward to downward.
Upwards to downward, because the wall is damaged already,
Okay.
right? So the blood is not going, it's pulling down. So that's a reversal, you can see that. Another vein is there, the deeper system, deep vein, right? Sometimes those having the varicose vein, they may get some small clot or something on a deep vein system. So that also you can evaluate and diagnose very well by the ultrasonography.
Okay, but what are the causes? Talking about the causes, is prolonged working or prolonged standing on legs, or what are the basic causes for such varicose?
See, the basic causes is the prolonged, long standing hours.
Just the blood flow gets accumulated in the veins.
And that wall may sometimes get damaged also.
Okay.
But when you see in a woman, right, after the pregnancy, this happen very commonly.
Yes.
Right? Because so much pressure is there in the abdomen. So because of the back pressure, the one or two wall they may get damaged also. So during the first pregnancy, they may not having any problem. But when they conceive another pregnancy comes, so that time this condition become more worse. Because in the second pregnancy, this wall get further more and more damaged.
Dilated.
So that's right. And even the obesity also is the big problem nowadays in society. So those are the obese. They may develop the varicose veins also.
Okay, so talking about the lifestyle, how does this varicose vein affect the lifestyle?
Once I wanted to tell that how the lifestyle that gives the varicose vein to you.
Okay.
Nowadays we are seeing particularly in the young women, right? Those are wearing the high heel sandals. That
yes.
also can cause the
Generally girls wear.
Even sometimes I've seen that low-lying tight jeans.
Yes.
Right, because the low-lying tight jeans which comes into your pelvis, right? So that compresses the superficial vein.
Okay.
And that gives the engorgement and dilatation into the leg vein also. So even I don't say that okay, you don't do this kind of things or a tight jeans or a high heel sandals, but you should know that this can happen by that. So you should take some little precautions and other things also.
Take care about it. Avoid wearing tight jeans and high heels for a long period.
For a long period.
Okay, but who are the people who are very prone to get varicose vein?
Those having the standing jobs.
Okay.
Obesity. Pregnancy, you cannot avoid that.
Okay, yes.
But you have to take some precautions to avoid the varicose vein, right?
Okay, you said about the one condition when the veins get swelled up. But what about the next step? What happens when these varicose veins get worsen in condition?
See, the beginning of the symptoms is just the pain and the discomfort and some heaviness. But later on, when you not treated this one, right? So furthermore, what can get the person, right? May get some color changes, pigmentation. May sometimes develop the venous ulcer also.
Okay.
Venous ulcer is not healing ulcer because the venous pressure is so much, and the venous pressure on the venous blood, the less amount of the oxygen is there. So that's why it's difficult to heal also. That may continue this venous ulcer for 1 month, 2 months, 3 months. Sometimes I see the very small size to the bigger size of the venous ulcer.
Growing gradually.
It is growing gradually, yes.
Okay, what are the treatment options for varicose vein?
In majority, those don't have any problem, so they're not required any treatment.
Okay.
Remaining, those having the early problem, they may need just the compression stopping. But those are the complicated by worsening the varicose vein. They need either the surgical treatment or a non-surgical treatment. Initially, the people that do the surgical treatment, that technique is called the vein stripping surgery.
Vein stripping surgery.
Vein stripping surgery, yes. And in that, they do the 1 or 2, 3 cut, and they take out the main vein, which is the dilated and tortuous.
So from where is that vein taken out? From the leg portion
they
only?
do the surgery. They do the surgery right from the ankle to the groin, and they take out the vein. But what the problem comes in the vein stripping surgery, the recurrence rate is too high. Right? Once they taken out the vein, then again the comes very faster sometime. That again depend upon the grading of the varicose veins. So now the non-surgical treatments are available. That is the much better than the surgical treatments. In non-surgical treatment, the 2 options are there. One is the laser is there, and another is the radio frequency ablation. Radio frequency ablation is the latest kind of the treatment.
RFA.
Right, RFA. And this technique over the other techniques, right, surgical and other techniques, right, this is the one of the best technique is there today.
Okay.
I don't know what is going to become the tomorrow, much better than the RFA. But RFA gives the overall the success rate about 98 to 99%.
Okay.
That again depend upon the grading of the varicose vein. And this required not much long hospitalization. This required just a 24-hour hospitalization. But this technique has to be done in the sedation.
Okay.
It needs some kind
anesthesia.
of a mild anesthesia or a major anesthesia. Major is not required generally, right? But this need that. But particularly in this technique, in the radiofrequency ablation, the rest is not required.
Okay, you can go to work next day.
Even radio frequency ablation you done in the morning, so by late evening patient can start walk around and other things also, and within 1 or 2 days they can start driving and other things also.
Okay, that's nice.
And another advantage is there on this one, there is no stitches, no scar comes on this one.
Okay.
So this is one of the best non-surgical technique which is called radio frequency ablation.
Radio frequency ablation, yes. This seems to be very interesting because once you done the treatment to a person and he's able to walk by the evening, what's the procedure used for RFA?
RFA is the radio frequency ablation. This required just a 24-hour hospitalization. And normally what we do that, right? We enter into this dilated vein through the ankle.
Through the ankle.
Through the ankle. And this entry point comes the very small, not required even the stitches also.
Okay.
So no scar comes on that. Through that small entry, right, there's a radio frequency ablation applicator is there. When the long thin instrument comes, right, that enter from there. And whatever the dilated veins are there, right from the groin to the ankle, we make the narrow.
Okay.
So the excessive amount of the blood which is not accumulating there.
Okay.
Along with the varicose vein, lot of side branch also there, which normally we see from outside. And some perforator also there. Perforator is the another vein which also become a worse in varicose vein patients, which is connecting from the deeper system to the varicose vein.
Okay.
So that vein you also has to be closed or make a narrow. Once you make the narrow on this one, right, so they won't get the accumulated blood. So there all the problems go slowly because the swelling comes in the long time, but it takes time to go for it, like 1 week, 2 weeks, 3 weeks time. These are the technique for a radio frequency ablation.
Okay. Yeah, but doctor, a lot of people take this very lightly. They think that there's a mild pain in their leg and that it will go gradually, but they don't treat it. So what can happen if varicose vein left untreated?
When the time passes, so this become a more worse and worse. A lot of people they think about this, medical management. I'm taking this medication, or a allopathic or a Ayurvedic medication, so I need the treatment. But nothing happens by the medications, right? So if this become a more worse, if treated, not treated for a longer time, so what the comes, because this vein become more dilated, and because of the slow flow in the vein may sometimes develop the clot.
Okay.
Particularly the blood clot, sometimes the 70% of the people those suffering from the varicose vein, they don't know, right? And some people they say, okay, go for a light massage or something. So that time is the very dangerous. This clot may detach and they go to the heart or lung also.
Okay.
So this is not a really good.
This is quite risky.
So this is the one thing is the clot if not treated, right? Another time this clot may sometime migrate to the deeper system.
Okay.
If it goes to the deeper system, deep vein is there, right? So that is called as a deep vein thrombosis.
That is even difficult to treat.
Even difficult to treat also, and particularly difficult to treat in a woman because when the DVT is there, so normally doctors they start the blood thinner medications.
Okay.
If the blood thinner medication is there, when their next menses comes, because of the blood thinner, they get the massive bleeding also.
Okay.
So that time difficult to manage the dose for a blood thinner also, to whether you should treat the DVT or you treat the other conditions. Right, so that's the another problem comes.
Okay.
Another time these are the venous clot. So venous clot get easily infected.
Okay.
That is known as the thrombophlebitis.
So it's very important to cure that.
Yeah, sudden onset of the severe pain comes, swelling comes, redness comes. These are the sign of thrombophlebitis.
Okay.
So these are the main problem comes, right? And another problem comes when the venous ulcer is there. So venous ulcer, non-healing ulcer, getting the superadded infection also, and because of the less oxygen in these veins, may sometimes they develop the skin infection also. So these are the secondary infection, that these are the like fungal infection comes, right? So this fungal infection also is not a good. So mainly if you're untreated, what the problem comes? One is the clot comes, thrombophlebitis comes, infection comes, DVT comes, may sometimes this clot go to the heart also, may sometimes the venous ulcer also. Very long list. So better to get the treatment when they have the symptomatic, when they have the problem, earliest as possible.
Okay. Should be treated on time, otherwise it can cause a lot of problems. Okay. Is the treatment of varicose vein by radiofrequency ablation covered by insurance?
Yes, most of the insurance, they cover the varicose vein ablation treatment.
Okay, so what are the other non-surgical treatments you offer?
Other non-surgical treatment is a long list, right? Being like intervention, vascular intervention radiologist all over the world, when you see that there's so many number of the diseases are there. So today just I wanted to tell you about what the common type of the non-surgical treatment normally that general public also knows about that. Like a uterine fibroid, adenomyosis, pelvic congestion syndrome, blocked fallopian tube, and varicose veins, what we talked about that right now, and back pain because of the disc herniation. In this we do the ozone therapy and nerve blocks kind of things, and even the untreated liver tumors, that also can be done by the similar kind of the technique, right, the radiofrequency ablation. And in man, the large prostate and the varicocele. Varicocele is the condition, you know, that like the tangled vessels comes in this scrotum, that normally happen to the younger age. So people, they don't like to go for a surgery, right? So the embolization technique is the one of the best technique for them today.
Okay, so there is wide number of non-surgical treatments you are offering. That's very good. And thanks for sharing your information on this varicose vein. I hope this will impart knowledge to people who are suffering from leg pain, and they'll diagnose that either they are suffering from varicose vein or not, and get a non-surgical treatment for sure. Thank you for coming, Dr. Muller.
Thank you.